Well, drive around Denver and you may see some sights like these. Iconic Denver buildings lit up in blue for Diabetes Awareness Month.
Today is World Diabetes Day, and I recently got a chance to talk to the doctor from the Barbara Davis Center for Diabetes on the Anschutz campus to learn more about the disease. I'm honored to be joined now by Dr. Paul Wadwa, Medical Director of the Pediatric Clinic at the Barbara Davis Center for Childhood Diabetes. Doctor, it's so great to have you. November is Diabetes Awareness Month, so let's just start with that, more on awareness. Can you tell us more about type 1 diabetes and who's impacted by it?
Sure. So type 1 diabetes is an autoimmune condition where the body stops producing insulin. So it's really important that somebody with type 1 diabetes gets insulin. It's usually given by either injections or a pump. Type 1 diabetes affects over 1.3 million Americans, so it is fairly common. We generally see it diagnosed in childhood, but it can be diagnosed in adults as well.
And this is different than type 2 diabetes. It's something people deal with their whole lives. Can you explain the difference?
Sure. So type 1 diabetes, as I said, is an autoimmune condition where the body stops producing insulin. Type 2 diabetes is a little bit different, where the body is more insulin resistant. So the body's still making insulin, it's just not being used effectively. We can see type 2 diabetes in adolescents or teenagers, but it's much more common to be diagnosed as adults.
And what does a diagnosis of type 1 diabetes look like typically for kids and their families?
Yeah, that's a great question. So typically, a child with type 1 diabetes might have increased urination. They might have excessive thirst. That might be bedwetting, where they were not previously having problems with that. They could have unexplained weight loss and fatigue. So these are all symptoms that would indicate that they should get seen by their doctor and evaluated for possible diabetes. If those symptoms are missed, then the child can actually get quite ill and end up in the hospital. Obviously, we want to do what we can to prevent that.
And how have treatments advanced over the years?
Well, it's a big area of research these days. We think that there have been tremendous advancements. If you look at 15, 20 years ago, the majority of people with type 1 diabetes were treated with multiple daily injections, checking their blood sugars by poking their finger and getting blood. These days, the technology has improved quite a bit. We have better insulins than we did 20 years ago. Insulin pumps are being used much more commonly, and continuous glucose monitors, or CGM, have a way of monitoring the blood to look at the glucose levels or sugar levels every 5 minutes. So the technology these days has really improved. We're able to get better control than we used to. And that means that people with diabetes can live healthier lives.
That's great. And we know this month some iconic Denver facilities, they're illuminating their buildings with blue lights as a symbol for support. How can those watching at home, what can they do to show support this month?
Well, that's a great question. You can look out for those buildings around Denver that have those blue lights on. You can look online and social media for information there. I believe there's a hashtag T1Determined that will be really prevalent. And then World Diabetes Day is an international day that's coming up on Saturday, November 14th. So there'll be a lot going on with that too.
Dr. Paul Wadwa, thank you so much for your time and for your expertise.
Thank you.
And again, today is World Diabetes Day, so perhaps wear blue to show support for those dealing with diabetes.